The following risk factors is most strongly associated with the development of neonatal intraventricular hemorrhage? Okay. A neonate born at 28 weeks gestation is admitted to the neonatal intensive care unit due to respiratory distress and low birth weight. On the fifth day of life, the neonate develops seizures and bulging fontanelle. A cranial ultrasound is ordered. Which of the following is risk factors is most strongly associated with the development of neonatal intraventricular hemorrhage in this patient? Okay. Definitely thinking any type of like hemorrhage and intraventricular and everything is hypertension. So I would definitely lean towards maternal hypertension as like my gut answer.
Okay.
Asphyxia, I don't know why that would. I would go with this. Yeah, I would just go with this.
Okay, so it's actually premature birth. So when kiddos are preterm, they have an increased risk of intraventricular hemorrhage. That's because
Mm,
the immature cerebral vascular in the infant is more susceptible to ruptures and hemorrhages. They're just not as strong. I think that their vessels are not as strong of a wall. So as they get born, then if their head bangs out a little bit, then they can have intraventricular hemorrhage. Asphyxia is hypoxic ischemic encephalopathy in neonates, but it's not the most significant risk factor. IVH, hyperglycemia is not a major risk factor either. Hypertension is a risk factor for complications during pregnancy, such as preeclampsia, interuterine growth restriction, but not for IVH. And then
okay,
sepsis, meningitis, multi-organ dysfunction, but IVH is not on there. So just remember that if you're a preemie kiddo, you have an increased risk of that kind of hemorrhage. Okay.
that's good to know. That is really good to know.